Good afternoon and welcome to the Washington Medical Commission Patient-Focused Webinar Series. Today, as part of Patient Safety Week, we are discussing how to research your healthcare provider and diving deeper into the EHR. I am joined by WMC Public Member Ms. Christine Blake and Deputy Executive Director Micah Matthews. Now, before I turn the webinar over, I do want to take care of a few housekeeping items. We encourage you to ask questions throughout the presentation, so look for the questions box on your webinar portal, and we'll do our best to address your questions toward the end of the presentation. We hope that you don't have any technical difficulties, but if you do, look for the help button on the webinar portal to get your issue worked out. We are recording this webinar, and the on-demand version and slide deck will be available on our website within the next few days. Please feel free to share these resources with your colleagues. And lastly, we want our learning events to be as interactive as possible. So please feel free to use our social media platforms to share what you have learned and keep the conversation going, especially during Patient Safety Awareness Week. Now, with all of that out of the way, I will turn it over to our panel.
Good afternoon, I'm Micah Matthews. So I'm going to take you through a couple of the basics of the Medical Commission. The Medical Commission is a group of individuals who are appointed by the governor. And so currently we have 13 physicians, 2 physician assistants, and 6 public members, of which Ms. Blake is one of them. And the public members and the physicians are an at-large appointment. The other physicians, they are by congressional district, not legislative district for the state, but congressional. And they're tasked with basically overseeing the medical care delivered in this state. Next slide, please. And so the purpose as defined by law is to protect the public by assuring quality healthcare is provided by physicians and physician assistants. I would point out that this is allopathic physicians, not osteopaths. Those are DOs, not MDs. Very, very similar in their practice generally, but there's a separate board for overseeing them. And so they establish and monitor and enforce the qualifications for licensure, consistent standards of practice and competency. And that's done generally through a complaint intake process, doing rules, working with the legislature to establish limits or thresholds for licensure and that sort of thing. Next slide, please. And so really we've been talking about that. So we have the power at the WMC to take reports and assess complaints, investigate, make recommendations to the commissioners on what complaints should possibly be charged, and then the commissioners serve as reviewing members on disciplinary cases or hearing panels that are governed under the administrative law construct. They also develop more frequently, they develop rules, policies, and procedures with respect to medical practice in the state. Just an example of some of those are we have guidelines and policies about retention of medical records, of how to best start practicing telemedicine, establishing continuity of care via telemedicine is a very popular one, as well as a whole list of other things that deal with clinical practice or administration, PA-specific practice agreements and policies, and that sort of thing. So next slide, please. So just a few terms as we're going forward. So we are going to be talking about the electronic health record, as well as the electronic medical record. So it's important to know the difference between these two as we discuss them. And so really the focus here is looking at what you see as a patient in the office of the clinician. And then the electronic health record is going to be a little bit broader in our discussion towards the end with Ms. Blake. I also want to point out that we will be talking about items that really came to play with the Affordable Care Act creation in 2010, as well as the more recent CARES Act in 2020. There's a specific item that we'll be talking about there and how that has influenced how patients access their care, and more specifically, how they get information through their EMR. Next slide, please. So sometimes this, as we see from our complaints, gets a little confusing. So I just want to clarify, the Washington Medical Commission is the regulator for licensees of the MD and PA type. And so we enforce those standards of competencies and that sort of thing. The State Board of Health deals with broader public health issues that impact the public. And so, drinking water, newborn screening, if you've had a child and they get the prick on their foot and they give the blood and all that stuff, that's State Board of Health rules. The other thing that probably most people are aware of is vaccinations. So in the past 4 years, we've seen quite a bit about vaccination rules for attending schools, going into public spaces, and I'm sure with coronavirus, we're going to see some more. All of that is State Board of Health, not the Medical Commission. And so we just want to clarify that up front before we move forward in some of our discussions. Next slide, please. And finally, I wanted to make everyone aware that there is a Washington state specific way to look up your practitioner, whether it's a physician, whether it's a nurse, whether it's a nursing assistant. You have the ability right now to go to doh.wa.gov and look at provider credential search. We also have a link on the Medical Commission website, which you can see as wmc.wa.gov. And you don't have to have all of the information, but it's good to have a lot of it. So if you know the name of the practitioner, and it would need to be a pretty specific name, you would need to have that. But if you have the type of credential, that's always good to have, and it helps narrow down the search. Having the credential number is probably the most fireproof way to be looking into a large database. You have to remember that there's over 480,000 licensees with Department of Health, the Medical Commission, and the Nursing Commission combined. So we're having to search through all those records to find the right one. So as much information as you can provide, that's excellent. And then also going through the slide, you also have the name, and then you have the CAPTCHA, but you also can choose if you have the exact match or if it starts with. So that's going to give you a series of results. And so looking at that, what that will do for you is it's a direct source for the licensee status. It'll tell you if they are licensed. It'll tell you when they next need to turn in CME. That's actually generally used more for by the licensee themselves to see when their next CME cycle is, or I'm sorry, continuing medical education. And then it also is considered the primary source of verification for the Department of Health and the Medical Commission. So that means if someone like a licensee needs to verify that their license is active and in good standing, they're fully entitled to get this, print the screen, and provide that. And it says it right on the top, it's a primary source verification. So with that, I will hand it over to Ms. Blake to carry us on to the next part of the discussion.
Thank you, Micah. So what is a patient portal? We've come a long way from when patients had to just call the doctor's office and sit on hold and wait and wait and wait to ask your questions, or for a call back because they're so busy. You now have patient portals. And with this portal, you can view, as it says here, your recent physician visit, what the notes were, the discharge summary of your visit, what medications you've been given, all your immunizations you were given, any allergies you have. And when a provider sends you for labs, you can jump onto your portal when they tell you that those are available and be able to see those yourself. You can also have dialogue with your provider, send messages to them, and they'll respond to you and get your prescriptions refilled that way without having, again, wait for someone to call you back, and schedule your appointments, look at what your benefits are, update any contact information. If you're married, you're changing your name, you have somebody else that you want to have as a contact for you, pay your bills. And a lot of times they will have forms available for you that you can just fill out and complete. So when you get into the doctor's office, you've got your forms available, you hand them to them, it saves you a whole bunch of time. When you get there, you're not sitting in the lobby for 10 or 15 minutes filling out forms. And a lot of physicians' portals or clinical practice portals have educational materials that you can click into. So I think it's always a great idea to pop in and out of there if you frequent your doctor's office, to just take a look and make sure that everything's accurate. Next slide, please. So the electronic health record, we just talked a little bit about that. They have information about anyone who had anything to do with your care. So as it says here, it contains information from all authorized clinicians involved in your care. They can share this information with other healthcare providers as needed. If you're referred to another physician for whatever reason, your provider refers you to an orthopedist, say, or another specialty, they can share that information with them. And this information follows you to hospitals and nursing facilities, so they can also jump in and get this information right there, and you're not liable for carrying around a notebook full of data. And I think that's also a really great thing. It keeps you from not having to worry about your medication list and all of your lab results and bringing all that with you, because it's all there in one area. Next slide, please. So there are several ways in different offices how to access your health record, but for the most part, there's a link that they provide for you in an email or on their particular website, and you get a username or password to use with that. If you don't have it, you can contact the provider's office again, and they will get that for you. Or you can use, some places have forgot the password prompt, and if you don't get a response right away, you can always call the office as well. You don't have to rely on that just to come back to you. You can check and view and send messages, and you should have your recent test results there for you to be able to look at, manage your record, and interact with your health records to make your wait time shorter and keep your staff more informed. So keeping that up to date as much as you can as well, and review it for accuracy is very helpful. Next slide, please. So how does it improve healthcare? We talked a little bit about how you wouldn't have to remember everything and bring your listen list with you. This helps that accuracy for you. Reduces medical errors because of the accuracy that is in there. So there's no mistake on what medication you are not taking, you're allergic to. If all that information is in there, that reduces that chance. Also, as it says here, duplication of tests, having had a lab test already and then having to have another one because you don't have the record, or it's not in there. So therefore, reducing any delays that you might have in treatment waiting for a lab result so that your provider can move forward, and reduces again the medical errors because of the accuracy of that record. So a lot of reasons why to use your patient portal. It's not always easy for people to navigate, and I do believe that your physician's office staff are more than happy to help you figure out how to navigate that. Next slide, please. How to discuss your EHR with your provider. Your physician has obviously many more patients than just us. We like to think that we're their best and favorite patient, but they do have so many patients, so they might not be constantly looking at your medical record unless perhaps they've interacted with you recently, you were there for a visit, so they're in your medical record. So they also rely on their staff and other people within their clinic to input data, the lab results, maybe what you've discussed with them, the past medical history that was put in there. So it's really helpful for us as patients and as the public to make sure that we review that every now and again, and make sure, especially if you've had an updated visit and your EHR is going to be amended because of that visit, to just pop in there and make sure that you're comfortable with what was written in there and that you feel that everything that you wanted to have covered or discussed with your provider, you can find in there. And if not, you can use that portal once again, message your provider, ask questions, and request a little bit more information get put in there. Next slide, please. We don't, as the public, have the authority to make the changes, and we can't make your provider change the record. What you might feel is an accurate change may, for whatever reason, for your for your benefit or for your health care or for what they put in there for any future care that you might need is the accurate information that another provider would need or that they would need when they get back in touch with you again. They might amend it based on what you tell them, so they can put amendments into a medical record. They can date it, that conversation with, or amend it as such, but they cannot amend what is already written in there. So use the portal if you have questions, but wait until, as it says, you have all of the information in there, like the test results or whatever you're waiting for. Next slide, please. Okay, well, I guess we're down to the question and answer.
One thing I will say, Ms. Blake, just
Uh-huh.
just lopping onto the last slide. The CARES Act did allow for near real-time access for
Yes,
patients
it does.
to their healthcare information, and so that is, I don't want to say has created problems, but it has created confusion.
Yes, it has.
And so I'll just give an example from my own personal life right now. My one of my family members is in the hospital and has been for a couple of weeks. And so while not the power of attorney, I am the one that manages this person's my chart account. So that's with Epic. And so you can get, just so you know, near real-time data with respect to test results or what a procedure has been going on and that sort of thing. And that does create some confusion. So if you're outside of a hospital setting, it's not the best practice to, as soon as you get a test result, message your practitioner and ask what it means. Most practitioners aren't even seeing what's in the EMR instantaneously like you are. They're having to deal with many hundreds, perhaps thousands of patients and their records, and so they're not seeing everything in the frequency that you are. So what I would recommend is, if you're outside of a hospital setting, give your practitioner 48 hours to at least see the test results, use their education and training, and understand and assess what that means for your care, and then message you. But outside of that, 48 to 72 hours, if you haven't heard anything, then message them and say, hey, I've got a question about this. It's okay to ask questions, it's okay to contact them, but recognize that they're getting, all of their patients are getting some kind of test result or information.
Right. Right.
And so
Thanks, Micah. Yeah, I
you just
agree
don't
with
want
that.
to you don't want to hit your primary care with practitioner with alert fatigue and message fatigue. Just give them a chance to read it. Just like, I'm sure we are all a little bit behind on our emails. It's basically, for practitioners, it is another email that they have to go through and read.
Thanks, Micah. Very true. We are not the only people that we'd like to think we are, but they do have many other patients. And piggybacking on what Micah just said, there's also basically real-time view in a hospital record, as Micah was saying, and that provider might be working with that patient or in the OR or somewhere, and you're watching all this real-time information coming through, and you're wanting them to tell you exactly what's happening right this minute, and they're not even in that medical record. They're concentrating on the care of that patient. So yeah, it's true. They need a little bit more time to be able to complete that patient's care, maybe move on to another patient and another patient before they complete all those records. So yeah,
Right.
a little
A
bit of
great
time
example
for them.
for the hospital thing was,
Yeah,
my family member was getting a central line, and I likely knew the result of the X-ray to verify that the central line was correctly placed before the actual healthcare practitioner did. They placed the line, the X-ray happened, and the results were read and put into the record. But I would have known probably prior by looking at the record than the practitioner did. So
right,
that's
exactly.
why I differentiate in the hospital versus outpatient.
Exactly. And it's hard for them to answer you when they're in the middle of something else. So yeah, or another patient in the clinic, or the data hasn't come in. So you're right. Thanks for clarifying that, Micah. They should get a little time to update that record. Um, I don't know if we want to take a minute and there's a couple of other places that you can check on your healthcare provider, and Health Grades is a website where you can search by specialty and by location, and sometimes your physician will pop up if they're in there, and you can find on that website a little bit about that physician, and you can see what other patients have written about them, any other comments that they've made, how they feel about them, how they felt about their care. And the Federal Federation of State Medical Boards, also their website, fsmb.org, has a free doc info on their website that you can look up your provider and get a little bit of information on their board certification and a little bit more background information on them. That's also another way that we as patients and the public have to check into our providers.
Right. The doc info site that you're talking about with FSMB, I believe, is docinfo.org.
Yes.
And it provides sort of what provider credential search does for the Washington state specific licensees. This is information provided by the state medical boards all around the country, all 71 jurisdictions, and it will look at MDs, DOs, and PAs. If they're licensed with a state board in the United States, you should be able to find them on there. So it does provide more information. It's not a primary source accredited, I guess is how I would say it. It's not considered a primary source of verification like the provider credential search is, but it is still trusted, verifiable information. You can see disciplinary history. You can see, as you said, board certification, education, where else they're licensed. So there's a lot of good information there that you can check, and you also see a longer history there than you generally will see on something like health grades or even the provider credential search here in Washington.
Yeah. Hospital affiliations, which are important if you're wanting to know if your provider has privileges at a certain hospital. And it's good to know that they do, because hospitals do also some additional and ongoing check of credentials. So if your physician is on staff at a hospital, that's another safety net.
Right, and I know that with patients, you're often dictated by your insurance who you can see, and so for better for worse, our healthcare system is going to require that you see someone in your network, and so this is always going to be at least a two-step process for patients when they're looking up practitioners or establishing care, and that is you have to use your insurance provider's network, and usually there's a website that lets you look up people in your area. Once you narrow that down, go ahead and write down the names and look them up either on provider credential search or doc info, and look them up and see what you can find and what information. Just because a practitioner maybe has a history with the regulator doesn't necessarily mean that they're a bad practitioner.
Right.
Not all interactions with the regulator means that someone can't practice medicine effectively. Much of what we do is what I would call minor corrections, and so everything from medical records to there was a medical error, but that doesn't mean that we throw the proverbial baby out with the bathwater, so to speak. People still can practice medicine safely and well. And so the issue of reading up on your practitioner is more about transparency, as well as what I would consider fit. You want to make sure that the practitioner that you see can, with the information that you have, most closely associates with the values or the needs that you have. And so that's also part of it. If you have a very particular set of medical conditions, you need to be looking at someone that specializes in those if you can. If you don't need much care, maybe you need someone that is more into telemedicine or virtual care that's more flexible for your schedule. So these are all tools that you can use to research your practitioner and find what works for you.
So thank you so much for a wonderful presentation. If you have questions, you can use the question box to type those in. Alternatively, you can also raise your hand and I can unmute you. But while we're giving a second for folks to type in questions, we did have a question that was submitted earlier. It said, can you show how to check on the details of complaints against providers on the DOH website? And my panelists, I can share my screen and do it, or I can hand it over to one of you if you'd like to show it in real time, whatever your preference.
since we're sharing your screen, go ahead and do
Yeah.
yours.
Okay, so can you see our website?
Yes.
Okay, so to look up the details of a provider, you go to wmc.wa.gov and then just scroll down to the bottom where you can look up a doctor or a PA. This takes you to the provider credential search on the DOH website. Then you can just pick your credential. I'm just going to start typing in physician.
Jimmy, we're not seeing much change on the screen. It still shows the medical commission website.
How about now? Let me try stopping sharing and starting again.
Okay. There we go.
Yeah.
Okay. So this is, they said, the DOH provider credential search, and then I just started typing in physician, and then I stopped, but that's okay. So you're looking for a physician and surgeon license or whatever credential you might be looking for. And then for this example, I don't know the credential number, and I don't know a whole lot about my doctor. Let's just say last name starts with a B, first name starts with a J, and we have to put in our CAPTCHA. So this is how you would look up, this is what you would get. You would get a whole.
I'm not sure we're getting anything. Sorry,
No.
Jimmy.
So no, Jimmy, it's still stuck on the search criteria page without.
Tell you what, you want to shoot it over to me and see if it'll have better luck.
Sure, I can make you the presenter.
All right. Are we seeing everything?
Yes.
All right. So Jimmy, if you just want to walk me through what you want me to type in. Physician, I'm assuming.
I don't know. This is just a question, so you have to ad-lib it.
Great. I don't know what we'll do there, so we'll just do Smith A and then the CAPTCHA. So when you don't have the exact information, you're going to get a list. And so as you can see, we've got a pretty decent list just under the A's. And we'll just go all the way back here. And I'm going to pick on this one just because it does show that if you look in this corner here, it does say enforcement action. So that'll just have something to show you. And when someone has an enforcement action, if it's within a certain amount of time, you would see the various documents that were a result of that. So whether it be a stipulation or an agreed order or a final order or something like that, and that would show those documents say exactly the circumstances for the reason for the regulatory action, and also what was done to mitigate it and how long it would last. So in this case, this person had their expiration date of the license in 2010. It says that it's expired, and yes, there was enforcement action. So you can also see, as I said, the year of birth, the CE due date. So when they have to turn in a certain amount of CME. So I believe for the medical commission, it's 200 hours every 4 years of CME, and then also just the credential type and that sort of thing.
if you're looking for specific details of the complaint itself, you'll have to go through the Public Disclosure Record Center for that. And there's a portal where you can go and request complaint details about a specific provider.
All right. And Jimmy, were you wanting me to go to that?
Sure.
We
All right.
lost Jimmy.
Yeah, we lost Jimmy. Sure,
Ah.
we can go to that.
I already have the DOH portal pulled up. Hold on just a second.
Okay, if there's a way to make you the presenter, I don't know how. Ah, yes, there it is. So this is the online request. You can do a whole number of things. It used to be that we would just have to send an email and you would get an email response. Now you can actually do all of your requesting online. The My Request Center allows you to track status of the request, so you don't actually have to send in pings and say how long is it going to be. I've never seen the trending topics piece before, but I'm sure that medical commission actions do occasionally trend in there based off of the requests that we seem to get. So if there's any questions on public records and that sort of thing, we're happy to try and answer those, but generally we refer those over to the Public Records Center. And with that, we will hand it over to any questions. Amelia, do you have any questions?
No, there are no other questions and no hands raised.
All right. Well, we thank you for attending this webinar. I appreciate the time for Ms. Blake and her preparation in this. And we hope you found some of this material enlightening and that you can use it in your healthcare journey. If you have any questions, please feel free to give us an email, which is generally the best response, which would just be medical.commission@wa.gov. And once again, this is Ms. Christine Blake, and I'm Micah Matthews, and thank you to Amelia for helping guide us on out. Have a good day.
Thank you.
Thank
Have
you,
a good rest of
everyone.
your day.